According to the Adolescent Sexual and Reproductive Health in the United States fact sheet, in 2011 to 2013, among unmarried 15 to 19-year-olds, 44% of females and 49% of males have had sexual intercourse. Minors should be able to purchase birth control without a parental consent. I personally was put on birth control at the age of 12, and not because of sex, but because of medical reasons. Teenagers will make the decision to be sexually active with or without a parental consent. Therefore, they should be able to have the choice to use protection without a parental consent. There are a wide variety of birth controls, many benefits of birth control, and minors should be able to purchase birth control without a parent's consent. There are many types of different birth controls available. The first type of birth control that I am going to be talking about are natural methods of birth control. The first type of natural ways of birth control is called abstinence. Abstinence means no sexual activity, and this is 100% effective. The next type of natural method is called withdrawal. This is when the man removes his penis from the vagina so that ejaculation occurs outside of the vagina. This way is 80% effective. The next type of birth control that I am going to talk about is called barrier devices of birth control. Barrier devices of birth control prevent the sperm from meeting the egg. The first type of barrier device is called a male condom. This forms a barrier to prevent pregnancy. The male condom is also the only birth control that prevents against STDs. Male condoms are 82% effective. Another barrier device of birth control is the female condom. The female condom contains a flexible ring at each end. One ring fixes behind the pubic bone to hold the condom in place, and the other ring stays outside the vagina. The female condom is 79% effective. Another barrier device of birth control is called the sponge. A sponge is inserted into the vagina along with some foam. The foam is spermicide that destroys the sperm when the sponge acts as a barrier. 12 out of 24 women out of every 100 will become pregnant using this method. Another barrier device used for birth control is called the diaphragm. A diaphragm is a dome-shaped barrier that is placed into the vagina over the cervix. When used with a spermicide, it is 88% effective. When it is used without a spermicide, it is 77 to 83% effective. Another type of barrier method of birth control is called the cervical cap. It is a barrier device that fits over the cervix and blocks the sperm from entering the uterus, and it stays in place by suction. When used with spermicide, this is 88% effective, and when it is used without a spermicide, it is 77 to 83% effective. The next type of birth control is called depot injections. Depot injections are also called the shot. The shot is a progestin-only, long-lasting, reversible, and prevents pregnancy by preventing the female from releasing an egg. This requires a doctor's visit every 3 months. It is also 94% effective, and it does not protect against STDs. The next type of birth control is called a pharmaceutical type of birth control. The first type of pharmaceutical birth control that I'm going to talk about is called the IUD. It's called the intrauterine device. It is a T-shaped device that is inserted into the uterus by a physician. There is a copper IUD that releases copper and acts as a spermicide and can last up to 10 years. There is also a hormonal IUD that contains progestin, and it prevents sperm from reaching and fertilizing the egg by thickening the cervical mucus and thinning the wall of the uterus. This one can last 3, 5, or 10 years. The IUD is also 99% effective. The next type of pharmaceutical contraceptive is called a contraceptive pill. The pill is taken daily and contains 2 hormones, estrogen and progestin. Hormones stop the release of eggs, which makes the lining of the uterus thinner. This is 91 to 95% effective when taken correctly. There is also a contraceptive patch. This is applied to the skin and releases synthetic estrogen and progestin hormones. It is worn each week for 3 weeks, and there is no patch on the 4th week, which allows for ovulation. It is usually worn on the lower abdomen or buttocks, and it is 91% effective. The next one is called the vaginal ring, or also known as the Nuva ring. This is a flexible and plastic ring that releases low doses of progestin and estrogen over 3 weeks and prevents ovulation and thickens the cervical mucus. The female inserts the ring into the vagina for 3 weeks, and then she removes it for 1 week, allowing for menstruation. This is 99% effective when done correctly, and with human error, it reduces the effectiveness to 91%. The next type is called the implant. It is a rod with a core containing progestin that releases slowly. It is inserted into the female's arm underneath the skin by a doctor. It is effective against pregnancy and does not protect against STDs. Another type of pharmaceutical birth control is the morning after pill. It prevents ovulation, fertilization, or implantation of an embryo. It can be used up to 72 hours after unprotected sex. The first 24 hours of taking the pill, it is 95% effective. And once you hit 72 hours, it goes down to 60% effective. The chart shown here shows that the different kinds of birth controls that are used by a group of people. There are many different types of birth control available, including natural methods, barrier methods, and injections and pharmaceutical methods, and they each have their own effectiveness when used properly. Being educated on the different types of birth control available will help when choosing the best birth control for yourself. There are also many benefits to using birth control. There are many different types of benefits when using birth control. To start, it prevents pregnancy. It makes periods less painful and more regular. The birth control pills especially helps regular periods when you know exactly when a period is coming. It also lowers the risk of heavier menstrual bleeding, lower the risks of anemia, and eases painful cramps. Birth control also clears up the skin. It improves acne and hair growth. And last, the male condom can help prevent against STDs. There are many benefits of using birth control other than preventing against pregnancy. Since there are many great benefits to using birth control, minors should be able to make the choice to purchase birth control without a parental consent. If minors are making the choice to have sex without a parent's consent, they should allow the choice to use protection without their parent's consent as well. To start with parental consent, according to the article written by Kelly Wallace, 68% of teens say they agree with the statement. The primary reason they do not use birth control or protection is because they're afraid their parents will find out. Next, according to the Adolescent Sexual and Reproductive Health in the United States fact sheet, 18% of 15 to 17-year-olds and 7% of 18 to 19-year-olds reported that they would not seek sexual or reproductive health care because of concerns that their parents might find out. It is also important for pregnancies in minors. According to the Adolescent Sexual and Reproductive Health in the United States fact sheet, in 2013, about 448,000 U.S. women aged 15 to 19 became pregnant. Also, according to the same fact sheet, the Adolescent Sexual and Reproductive Health in the United States fact sheet, in 2013, 4 pregnancies occurred per 1,000 females aged 14 and younger. Birth control also helps with STDs in minors. Also, according to the Adolescent Sexual and Reproductive Health in the United States fact sheet, adolescents and young adults ages 15 to 24 accounted for nearly half of the 19.7 million new cases of STDs in the United States in 2008. HPV infections account for more than 2/3 of STDs diagnosed among 15 to 24-year-olds. And last, chlamydia is the next most common STI diagnosed among 15 to 24-year-olds that account for nearly 20% of diagnoses each year. According to these facts and statistics, minors should be able to purchase birth control without a parental consent. In conclusion, with or without a parental consent, minors are going to have sex. Therefore, they should be able to access birth control methods without a parental consent. There are many different types of birth control that are available, also supply a huge advantage to minors having sex, and minors should be able to purchase birth control without a parental consent. Not all families have open communication, and teenagers will make the decision to be sexually active with or without a parental consent. Therefore, teenagers should have the benefit to purchase birth control with or without a parental consent.